Good afternoon, everyone. So today I'll be presenting upon the impact of eye donation counseling on the willingness of patients for eye donation in a tertiary care hospital. The aim of my study was to study the impact of eye donation counselor on the willingness of patient who were then donate eyes. So the objective was to assess whether the patient was willing to donate eyes and the impact of counseling thereupon, and to study the reasons what were the rates for poor donation, and to analyze what were the motivating factors and the barriers for eye donation. So, in about 8 million people worldwide are blind because of corneal disorders, and currently around 1,20,000 are affected. So, we need approximately 2,50,000 corneas in an average, and the number of corneas donated per year are just 25,000. So, there's a lot of lag between. So to tackle this high incidence of corneal blindness, corneal transplantation has emerged as the main sight restoration procedures, especially for people who have just been affected by corneal blindness. So which mainly depends on the voluntary eye donation by suitable donors. The need for the study was to increase the donation by making the general population more aware and motivated. And these potential donors, if counseled adequately and effectively, can constitute to a substantial number of eye donors. The source of the data this was basically a hospital-based prospective study of patients attending in a patient and outpatient department, the doctors working there, the students and the staff of Santosh Medical College and Hospital in Ghaziabad. So all the people who consented for the study were included, and the patients, along with the doctors, the staff, the students, and the attendants or the guardians of the patients of critically ill and diseased subjects in the hospital itself were also included in the study. So it basically a questionnaire was formed, consent was taken, a questionnaire was formed, and people were made aware as per a module devised and approved by an expert committee. And the outcome of this intervention was then assessed using a single response questionnaire. It was initially, the questionnaire was validated after 30 initial responses, and this questionnaire was then used for all the other subjects. So this was the questionnaire. These were the results. To summarize, after 68 initial responses, about 73% people in those subjects had never even heard about eye donation. And among when asked that whom did you actually consult before making your decision whether you want to pledge your eyes after your death, 34% had said that they would just ask themselves, and followed by parents, their spouse, the children, and very less for the siblings. And when asked that what was the main concern before deciding whether to donate eyes, majority, about 42%, said that family will not be supportive of this decision of theirs, and around 21% each with body disfigurement and after death, and that their body will not be treated with respect was the main concern. So when asked that why don't you wish to donate eyes, they said that 40% majorly said that they had religious restrictions. About 28% said that they were objected from the family to do such, and about 16% said that they were concerned about how their eyes will be actually used after that. So they said that there was no transparency about how it is getting used. So basically, the knowledge and awareness about eye donation is, we found, was very significantly low in the community. Most of them have never even heard about it. The decision for eye donation was mostly self-driven, but family plays a significant role in the decision making. Religious restrictions were the chief reason for the unwillingness, followed by objections from family members, and utilizing eye donation counselors, we found, were a promising way to motivate and encourage people for eye donation. Thank you. Yes, ma'am.
Aditi, whom do you feel are the most important people who need to be motivated?
Ma'am, honestly, in general, everyone should be motivated, but especially the attenders of patients in ICUs, we found, because it's actually very easy to retrieve corneas because the time duration decreases a lot when you are retrieving patients who are in the ICU. So if death happens and if the patient was like the cornea can be utilized, it's very easy to get the corneas from there, rather than someone dying at home and then going there and getting the cornea. The time will be very limited.
And when is the appropriate time you feel you
Six,
can?
6 hour. It actually depends. Summers May it is less, and in winters it is more. Generally, 6 hours is the best time within 6 hours. Otherwise, in winters it increases.
Great.
And who are the subjects who answered these questionnaire?
Ma'am, it was actually everyone who was the outpatient department, patients who were coming in, their attenders, their family members, whoever had come in with them, the students there, the postgraduates, the staff, the GDA staffs, the nurses, everyone. We asked everyone.
So those who are already in the system, to give them a questionnaire would be, I think, a little bit of a, you won't get actually the results which you intend to.
Yes,
Your subject should have been just the attendance and the family members and the patients, I think.
People are doing kertoplasticity in our hospital.
yes, yes, sir.
So
Yeah.
after the study,
Yes.
how much improvement in the corneal surgeries?
Sir, mostly we actually have this pledge form. So we just motivate people to sign the pledge form at least, and we give them this pledge form that, okay, once in case someone dies or your family, they are actually, they just call us.
Actual impact of
Yeah.
this treatment.
We are waiting for the impact.
Waiting for no, it will.
Thank you.
Thank you.